Doctors, we're going to have a subset of patients that are not a good candidate for frank manipulation. As we discussed earlier in the presentation, we will have patients that will have absolute and relative contraindications to diversified Gonstead type of manipulating technique. So for those patients, it's nice to have additional tools in your toolbox. And in this case, what we're going to do is we're going to take a look at instrument-assisted manipulation. There are multiple brands that are on the market. I personally own 3 different instruments and they're all quite acceptable. I would strongly suggest that you don't purchase one sight unseen, but either test one out at a seminar. If that's not possible, ask for a trial period with it. I think most of the manufacturers are more than happy to place an adjuster into your hands. With the occiput, let's say again we have an extension restriction. In other words, we're locked into extension, which is going to be most common. We're going to have the patient slightly tuck your chin. And we have different kinds of instruments or tips that we could use depending upon what kind of restriction we see and what it is that we're hoping to accomplish with the adjusting. In this case, we're going to say that we have essentially a uniform extension restriction, and we can just take our contact point on the occiput, take our tissue tension out, and then deliver 5 or 6 nice thrusts. If you feel like you have more of an extension restriction on one side, then obviously you can substitute your tip for a single point. If you want to treat a patient who perhaps has more acute symptoms, then I recommend something more like this with a soft applicator that can absorb some of the contact. Again, this can be done either in the prone. I like to adjust my patients in the seated position primarily because you can actually take the structure through a range of motion. So if we're dealing with a patient with extension restriction, then what we can do is have that patient go into flexion, and as the patient is moving into flexion, we can be delivering thrusts throughout the course of the motion. Same thing with rotation or lateral flexion. And we'll have some more demonstrations on that more in 302 technique.